Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Dr. Tam Nguyen. Dr. Nguyen is board certified by the American Board of Family Medicine and has been treating patients of all ages since 2008. Beginning on the East Coast, Dr. Nguyen earned his BA at Johns Hopkins University in Maryland, followed by his medical degree at Pennsylvania State University College of Medicine. He completed his family practice residency at San Jose O'Connor Hospital in California. Dr. Nguyen served at San Joaquin General Hospital as part of their medical staff and clinical faculty, and as the Family Medicine Chair. In addition to family medicine, Dr. Nguyen is also board certified in aesthetic medicine. Dr. Nguyen practices medicine at Washington Township Medical Foundation.
Hopefully you'll find the talk useful for everybody. I try to cover a very broad topic in the next 90 minutes or so. What will we be covering? We're trying to prevent skin cancer and hopefully recognize some lesions that may be cancer currently, and just briefly on how to get it treated. And then skin damage, mostly from the sun, how to have a youthful skin, and then if you want possibly to maintain and reverse some of the aging process so that you can age gracefully. So let's start with the more serious, skin cancer. There are many types of skin cancer, but the most common are three of those, and that's basal cell carcinoma, squamous cell carcinoma, and the more deadly melanoma. These three skin cancer constitute more than 90% of all skin cancer, so we'll focus on these, and we'll go through the signs and symptoms. The first one is basal cell carcinoma. Basal cell carcinoma is the most common skin cancer. The risk factor is pretty much sun exposure, and it's not just when you have the cancer, but it's cumulative throughout your life, starting very young when you leave mom's canal to the moment you get diagnosed, and of course any ionizing radiation. What are its characteristics? Basal cell is very smooth. It's a papule, which means it's a lesion, and sometimes what they call have this pearly border and with tiny blood vessels, and I'll show that in the next slides. It can be rough, crusted, or pigmented, so it doesn't have to be always clear, and generally if you're over 40, you get this cancer. It's uncommon in dark-skinned individuals, but not impossible. The prognosis is excellent, is very good if you have it. If all cancer that you should get, this is the cancer that you should get, is basal cell. Not that you want cancer, but if you did, this will be the one. It rarely metastasizes, which means it spread beyond that particular lesion, less than 0.1%. So here's a very typical basal cell carcinoma. Very fine border. The pearliness, kind of like almost like the shiny kind of light reflecting off like this right there, and the blood vessels, these are the blood vessels. Now, don't confuse that with these blood vessels, as you know, especially lighter skinned people, they get these blood vessels as they get older. That's not the same. It's generally within the lesion. So that's basal cell carcinoma. Here's another one that's not fully round, but that's kind of a little bit ulcerated in the middle. And once again, you get these kind of pearly look with the vessels. Here's one that the vessels actually burst, and so it's bleeding. And so any lesion that bleeds or does not heal should be evaluated. Here's one that looks pretty normal under the nose that can be there for years and it doesn't even change, but it's a basal cell. Here's one that's hiding very distinctly right there. And then there's a little bit crust because occasionally it can bleed, especially if you scratch at it. Now these skin cancer are generally in areas that's been sun exposed through the life, not just recently. So therefore the face, the hand, and the foot are common places. The next cancer is squamous cell carcinoma. So the first one is basal cell. The next most common is squamous cell carcinoma. The risk factor for getting this is once again sun exposure. So that's a recurring theme. Immunosuppressant, so anything that you lower your immune system, and radiation. Unlike basal cell, there's no real general characteristics. It can be firm, it can be round, it can be anything, but usually it is crusted, it's ulcerating in the middle. The prognosis is still very good. Rarely, less than 3% ever spreads beyond the skin. The areas that are more likely to spread on the lips and the temple and on the hands. The more you wait, the larger it is, the more likely to spread. Here's a typical squamous cell. Now this kind of looked like a basal cell, so it's really hard to tell. And so the good thing is don't. If you have any concern, go see your doctor or come get evaluated. I see this a lot. It's kind of almost like a farmer's arm. They've been in the sun for a long time. It looks like just regular damages, but actually there are several squamous cell lesions throughout the hand and throughout the arms, especially if they sunbathe a lot during their youth or the person. Here's one that's on the finger. Now the other thing too is sometimes misdiagnosed as just an infection, impetigo or some other infection. Now, if after several months or even several weeks with the infection with your doctor, if it's not healing, definitely get it evaluated and have it biopsy. Under the mouth, not very uncommon to have under the mouth. So any ulcer, lesion in the mouth that doesn't heal, please get evaluated. Here's one on the side of the face. And this one is very characteristic. Once again, it's ulcerating with scab. It doesn't heal, it seems to scab. The scab goes off, then it ulcerates. Those are the type that are more likely to be squamous cell. One on top of the ear, and then these horn-like can be very characteristics of squamous cell as well. So melanoma, though much less, which is the good news, but it is the one that you're most worried about. This is the one that can cause death. Most of the death, if you die from skin cancer, it's from melanoma. The risk factor are several, but the one that I want to mention is called dysplastic nevi, or large number of nevi. Basically, what does that mean? It means that if you have more than 20 moles on your body, whether you're 5 years old or 50 years old, you're more likely to get melanoma, so that should be checked. The youngest I ever diagnosed someone that the dysplastic or atypia means that there's some changes already. Changes that could, not necessarily will, but could go to become a skin cancer. Like I mentioned, the youngest one I've seen was 5 years old. And so I was able to see that biopsy, and there was some early changes, so we just removed the whole thing. So a lot of moles, keep that in mind. So now there's no real good way to determine if regular black or brown mole is skin cancer, but here's some of the things that you can use by everybody as well as by providers, is the ABCDE rule. A, is it symmetric? Pretty much if you can fold it and it is pretty even, then it's unlikely. If it's asymmetric, the border is kind of rough and jaggedy, then it should be evaluated. Border, the border is irregular. C is for color. One uniform color is good. 2 color or more is more serious. Diameter, larger than 6 millimeter. Of course, we're in America, so we have to use the English system, so basically less than 1/4 of an inch. So anything larger than that size should be looked at. And E, is it raised? Anything that's raised should be evaluated. Now, there's a very common skin condition called seborrheic keratosis that can mimic any of these lesions, so it's really difficult. Just have to be evaluated because seborrheic keratosis will break all 5 rules. Any one rule should be looked at. Here's a typical melanoma. You can see if we were to fold it, it won't be a mirror reflection. So therefore, it's asymmetric. The border is very irregular, very jaggedy. There's 2 colors, this darker brown black and then a lighter brown black. And you may not appreciate, but it's actually raised as well. And the diameter, it's hard to tell from the picture, iced by itself, but it's larger than 6 millimeter. Here's another one, raised. This one it defies all 5 rules. It's large, it's raised, there's multiple colors, the borders. Here's one that could be bleeding. Now this looks very benign on any lesion. It looks like freckles. But once again, when you're not sure if there's any changes, now a normal mole through the years can change. So even though you have it looked at and the doctor says it's normal, you should have it looked at regularly. There's actually a lady that I'm evaluating right now. She said she went to the specialist and found it to be completely normal. We biopsied and there was early changes already. Ears behind as well as anywhere is visible. So if you have a family history, have a loved one looked at behind the ears, areas that you can't visualize. And on the finger, please forget about any streaks on the nail. It's early signs before it becomes like this picture. Here's a typical looking mole. That was melanoma. And here's another one. So I just want to show a few pictures. Here's one that looks pretty easy. In a sense, sometimes mistaken as an insect bite or a wound that won't heal for a while. And actually, this is pretty aggressive melanoma because of the certain features in the middle. For basal cell and squamous cell, there's multiple modality. Depending on the type and how aggressive, you just either freeze, you burn it off, you cut it off. With melanoma, you really need to do a little bit more in-depth prognosis to see how deep it is. Depending on the depth, it gives the staging. And if it's early staging, simply cutting it out with a moles procedure is a particular type of procedure, and that's done. Otherwise, you need to do sentinel node, possible chemoradiation, chemo or medical radiation. So it depends on the melanoma. It really is dependent on the prognosis and the staging. So let's go talk about skin health. One of the things that we'll be covering for skin health is the aging process. And then, of course, when there's damage, tobacco, moisturizers, different ways to keep the skin healthy. Although many times we wish that we don't age, but we do. There's many things that occurs during the aging process, one of which is your skin. And that's actually the most apparent signs of aging. Skin typing, there are 6 different types of skin. It's classified on how easily you get burned, your skin color, and different ways that we classify. But the skin type 1, the redhead, easily burned. They don't even go out in the sun, they think about the sun and they get burned. So that's skin type 1. Skin type 2 is, maybe more likely to be burned, but sometimes they tan. A lot of Caucasians fall in this. Skin type 3 is right in the middle. Half the time they burn, half the time they tan. Darker Caucasians, lighter Hispanics. Skin type 4, 5, and 6 are the darker skin type, and these are the people that has a lot of melanin, which means they can tolerate the sun a lot more without being burned. Sometimes your skin type can change as you get older, and more often than not, just don't look at somebody. Just especially South Americans, they have the blonde hair, the blue eye, but they're actually skin type 3 or 4 after you do a history because they rarely get burned. So it's not always typical just by looking. Next thing is the stages of wrinkle. So many times after you master this a little while, you can do a fun game of guessing people's age. And a lot of times, even though they take care of their face, looking at the rest of the body, their neck and hand, can really give them their age. So the first stage is early 20s to mid 30s. No signs of changing, maybe some fine wrinkles. Stage 2 is more middle age, between 35 and 50. And middle age is arbitrary. I just chose that. So some people can consider 80 as middle age. So this is where the dynamic wrinkles occur. What does that mean? If they're still in their face, there's no wrinkle, but when they smile, movement, there's wrinkle, and that's stage 2. Early sign of solar lentigines, which is brown, benign lesions from sun exposure. Some call it liver spots. And this is the keratosis that we were talking about. And then this is for the ladies and men, I guess, that start wearing some foundation, start to hide some of those blemishes. Stage 3 is as we get a little bit older, between 50 and 65. There's more wrinkles called static wrinkles. So you don't even need to move your face and you still see the lines. So that's static wrinkles. Dyschromia, just changes, pigments on the face. Telangiectasia, which is the blood vessel, especially on the nose that I was pointing out, that's not skin cancer. More keratosis, and generally you require more foundation to cover that up. And stage 4 is the more advanced aging. So that's just a staging of wrinkles. Hopefully at the end of the talk, you can go back from 4 to 3, 3 to 2, or at least stay in one stage for the rest of your life, hopefully. So how do we, or at least after this talk, slow down the process and possibly prevent some of the aging characteristics? The first thing is very obvious: sun, sun, sun. Sun not only damages your skin, increase cancer that we talked about, is the #1 cause for age and wrinkles. So if you have kids, grandkids, and you want to do them a huge favor, and they'll appreciate it, not at the moment, but maybe when they're 40, is to help them avoid the sun and sunscreen them. And we'll talk about sunscreen later on in a couple of slides. Sun exposure. So what's the benefit of sun exposure? The vitamin D. That's the biggest benefit for sun exposure. The other stuff, the tan, the golden California tan. That may be the case, but that shouldn't be the case. But especially in the younger, even I had met student colleagues when I was in school that still go and sunbathe, and so they pay a price later on. The danger, the pigment changes, the wrinkle, the premature aging, the skin damage, and of course, we have touched about all three cancer. Sun exposure put you at risk for skin cancer. Now, sunlight, even on an overcast day, because remember, the light is not what causes, it's the UV that causes, and that penetrates the clouds. So even an overcast day, cloudy day, you can still get the damage. Now, artificial tanning salons. American Academy of Dermatology do not recommend that, and I strongly believe in that. You suntan, you will age, and you will get, I believe, 3 to 5 time-folds getting skin cancer, because sunbathing is unfiltered, just outright UV light, and so you're exposed yourself. So really, not to put them down or close their business, artificial tanning is not good. Now, if you want a brown body for the younger or even the older who wants that, do the spray tan, okay, or the sunscreen that has tinted tan in it. Wrinkles. Some wrinkles are really cute. Others are not. Believe it or not, they're the same age. Sun exposure. Here's a twin study. The one on this side has limited sun exposure. The one on this side has a lot of sun exposure. Same age. Now, I don't know if the picture can show, but can you see all the brown spots and all the keratosis? That's what sun does. Here's another lady with a lot of sun exposure, spots all over her face. So, how to prevent sun damage? The worst time in sun exposure is between 10 and 3 p.m. So if you want to go for a walk, you need to do some gardening, try to do it after 3, ideally after 4 or 5, especially the summer month in the East Valley or the Central Valley, and then or before 10 a.m. That's when the worst worst UV exposure. And wear protective gear. Some of the gear has UV protection in it, or SPF, in which we'll talk about. And we talked about already, do not suntan, and either natural sunlight or tanning salon, because it does cause damage. Or if you do, just realize you will pay a price for that as you age. And then use sunscreen. Okay, let's talk about sunscreen. What are we trying to protect? Sunscreen is trying to protect 2 different types of UV, UVA and UVB. UVA breaks down to 1 and 2. Don't worry about the 1 and 2, but basically it's the longer wavelength, and that's what causes wrinkling. UVB is what causes the sun damage and the cancer. There are 2 types of sun protections. There's the inorganic or organic. The inorganic is what's called sunblock. The organic is sunscreen. There's only 2 types of organic or sunblock. That's titanium dioxide and zinc oxide. And organic, there's a ton of them. So the classic is the lifeguard who goes in the beach or the pool and that has the nose. This is either titanium or zinc oxide. It works great. Now, UVB, there's a bunch of, these are all organic or non-metal based, there's all of them, and basically you can turn it over and look at them. Now, if it's possible, the best recommendation to do all UVA 1, 2, and B is these 2 here, titanium and zinc. Now, unfortunately, it does give the white tint, and so many of those sunscreen or sunblock actually have kind of a brown tint in it, so that will help make it look a little better than just going your face look like Phantom of the Opera, the entire face. With UVA, that's only a few. So now if you do have to go for organic, like Aveeno Benzone, or it's a very nice one that covers all 3. So these are the ones that I would recommend. And the Parcel 1789 came from France, looks really great. And surprisingly, the more expensive one versus the very cheap one, there's no difference. So you can buy the Olive Olay for $100. Nothing against Olive Olay, I don't work for anyone. No disclosure, I don't have any benefit. Versus Walmart generic one. They all have the same ingredients. I would just pick that. Okay? So if you have to pick sunscreen, Aveeno Benzone, if you have to do that. Now there's a lot of debate whether organic should be used for kids or not because of the chemical, because it's a little bit of like steroids. So for kids, if you want to be safe, and hopefully they don't care what they look like, just use the zinc and titanium. Okay. Make sure you use water resistant. There is no such thing as waterproof. Nothing's waterproof. It's water resistant. Even then, you still have to put it on, especially for the pool, the beach area, or sweating, going for a swim or something, or going for a run. It needs to be applied every 4 hours if water exposed. Okay, SPF. What does SPF stands for? Sun protection factor. just to jump ahead, people say, what SPF should I use? The stronger the better, right? Not necessarily. If you look at this slide, SPF of between 15 and 45, even 50 is less than 5% difference. So here's the curve. Anything past 30, you don't get that much more benefit, except it's more costly and it's stickier and it can clog up pores. So for all skin type, SPF 30 is all that you need. Anything else, it's not necessary. And they've done the study. And the other thing too is SPF only applies to UVB. So therefore, when you buy sunscreen, make sure you look at the bottle, make sure it's full coverage, UVA and UVB. But by FDA rule, SPF is only UVB. Now, the FDA has been proposing to change the nomenclature for a while, but they haven't yet. So just kind of keep that in mind. Remember we talked about skin type? The darker skin type is the 5 and 6, the dark Hispanic, the Southeast Asians and African Americans. They may get away with SPF 15, but for the lighter dark skin, they need SPF 30. So when in doubt, SPF 30. You will get 97% protection with SPF 30. Now you go to SPF 100, great, now you get 98.5%. So another 1.5% for 3 times the concentration and thickness and stuff like that. The key is we should use it and use it regularly. You're not going to use it if it feels awful, it's greasy, and it ruins your clothes. So, but if you want to do SPF 100, that's fine. It doesn't do any harm, but the research has shown that you don't need any more than SPF 30. So what should we do with sunscreen? Use it every day. Whether it's part of your routine, use it every day. For the ladies, it can be in the makeup. Or the guys, in makeup, if you wear makeup. Ideally, you should reapply it at least once a day. I always recommend in the morning. I like it simple. I like 1 cream at night and 1 cream in the morning. So the morning, whatever your regimen is, as long as SPF, you're good. We'll talk about the night cream a little bit later. Make sure that both UVA 1, 2, and UVB. And also don't forget the lips. Now you can buy a special lip gloss, lip balm for the lip, or just use the same thing for your face. So you can just wipe it over the lips. It works just as well. It's the same ingredient. Ideally every 4 hours or every time you re-expose it to the water. But I know it's difficult, so at least once in the morning is good, especially if your job is mostly indoor. Okay? But when in doubt, always reapply. Key, 30 minutes before you get sun exposure. So especially those vacation in Hawaii. How often do I see kids and their family putting on right at the beach? During those 30 minutes, they're not getting any protection. So put it on at the hotel room, at home. Then by the time you commute there, it should be 30 minutes. And so 30 minutes before. If you really want, it should be if you really wanted to measure, it should be 1 millimeter thick coating across the skin. Okay? No one does that, so just make sure it's an ample amount. My wife liked the spray because it's easier. I like the lotion. The reason the spray works equally well, but the problem is that you have to spray a lot because sometimes the blotches go out and there's a certain area that's not protected. So I compromise with my wife. She sprays it and I just smooth it out. So just keep that in mind because it has to be even. Consider water resistant, especially if you're around water or be water exposed. There's no such thing as waterproof, but some of them are resistant where you can apply not as frequent. Okay, so that's sunscreen. So smoking, what can I say? Just stop smoking. I don't know of any benefit for smoking, except even the cool look is no longer there. Sun exposure is the number 1 for aging and skin cancer. Number 2 is smoking. With smoking and sun exposure, 1 + 1 is not 2. 1 + 1 is 5 in terms of increasing the risk factor. So please stop smoking. If you don't want to stop smoking to prevent skin cancer, then for your youth. Like I mentioned, if you do smoking by itself, it can accelerate the aging process 2 to 7 times. Here's an example, computer model, and that we've seen it throughout. I don't know if it showed very well. Here's typical aging without smoking. Here's with smoking. The problem is that by the time you realize it's too late. I mean, then you have to pay me a lot to reverse you back here. And we're not covering that today, which is the Botox, the filler, the laser, and all this other stuff. But stop smoking. And it doesn't matter if it's chewing tobacco, if it's cigarettes, cigar, nicotine is nicotine. So, okay, moisturizer. It's very important to keep your skin moisturized. Let's go through why. Dry skin will cause damage because our skin is our barrier. So anytime it cracks, it can lead to infection. It increases aging and wrinkles. Once again, that aging. It's itchy. So when you scratch at it, it will cause a whole cascade of autoimmune system that will cause more itching and more dryness. So keep it moisturized. Of course, it will decrease the glow and weakens the barrier, which then cause other problems. And then for any condition that you may have, especially with eczema or atopic dermatitis, psoriasis, dry skin will make it worse. And actually for eczema, that's the #1 reason why you have it is dry skin. So let's talk about, now you know about dry skin, what can we do to keep it nice and moist and healthy? Don't worry about the NFF, it's a factors like SPF, it's called NMF, which is the natural moisturizing factor. Not all moisturizer are equal. Now, some of the best moisturizer are larger compounds, such as amino acids, like protein. Amino acids are protein. Lactate, which is a sugar compound, many sugar, urea, all these are some of the really good ones. Basically, what it does is it keeps the moisture within the skin, or the stratum corneum, and regulates. Once it's there, the skin is healthy. Now, if you don't have time to do the SPF that we talk about, hopefully you do, just keeping your skin moisturized will actually have some protection from the sun, because moisturized skin helps protect the sun more than dry, damaged skin. No real hard research, but maybe a factor of SPF 5 or 3, if just by keeping the skin moisturized, okay? Here are some examples of really good ones. The higher the percentage, the more better the moisturizing. So free amino acid or peptide or protein. There's different carboxylic acid, sugar, lactate. If you remember your chemistry, as the compound gets smaller, the moisturizing factor or the way it moisturizes skin gets less. Now it's important, there are 3 different types of quote-unquote moisturizer. There's humectant, emollient, and occlusives. Now occlusive, it is a moisturizer, it keeps the moisture in the skin there. Example, Vaseline is not a moisturizer, it's an occlusive. Whatever moisturizer you have will keep it there. Therefore, it's the best time to put stuff like Vaseline occlusive right after you shower, because there's a moisture right there. Put on the moisturizer right then after the shower. Emollient actually have some kind of agent in it, like lactate, the peptide, the protein. Humectant doesn't have it, but it draws the moisture from the environment. So in California, where the humidity factor percentage is very low, using humectant is not a good option. Florida, great option. You know, the East Coast where it's very humid, humectants are really good. So it draws moisture from the air. In general, regardless of what you use, avoid alcohol-based moisturizer. It actually worsens the condition, especially if you have a condition like atopic dermatitis. Why is that the case? Because more often than not, the general rule, if you put on a moisturizer and there isn't a sticky feeling to it, let's say it evaporates and feels great, then it has a moisturizer. Anything that's alcohol dries the skin up. And of course, we want our cake and eat it too. We don't want the grease that comes with moisturizer. We want our skin to smell good. We want all that, but unfortunately, we don't get that. So avoid any compound that has alcohol in it. And if there's time, which I think there will be, we'll look at how to read labels, and there's some endings that will help you determine what they are. Okay, here's a bunch of lists for you of what humectants are: the urea, the lactic acid, the sorbitol, the glycerol. Here are some of emollient. Lanolin is a good example. And there is occlusive mineral oil, petroleum, which is the Vaseline we talked about, dimethicone. Now, many times the moisturizer can have other stuff in it that enhances the way you feel. Antioxidant, vitamin C, vitamin E. There's different compounds that's supposed to have plant and stem cells, other stuff. Just keep in mind, anything that's not prescription, there's no evidence or no proof that it works. I'm not saying it doesn't work, there's just no evidence that it does work. So take it with a grain of salt. Let's talk about anti-aging. It's not just about aging, there's skin health. Once again, it's not simply, if you don't care how you look, at least make sure your skin is healthy. So there's what's called microneedling, there's laser, there's microdermabrasion, there's ultrasonic, there's the injectable, the fillers, the botulinum toxin, which is the Botox, Dysport, there's the different chemical mask, chemical peel. We're not going to go into that. If you have questions, you can ask me afterward, but we can do that. That does help. It does help reverse aging, but that's not the focus of our talk. I want to talk about is a family called the retinoid family. It's a compound of vitamin A. It's great for anti-aging and keeping the skin healthy. It has epidermal thickening. It thickens the skin. It improves fine wrinkles because the collagens produced, it actually studied collagen is actually stimulated. Therefore, it improves the shallowness, the divot in the skin, as well as improve the dyschromia. It downregulates the melatonin or melanocytes, which is the melanin, the color in your skin, so that certain area that's pigment or color, like she was asking, can improve. And the laxity, the skin gets loose. It will actually tighten because of the collagen. So it's actually a great compound to use. It was designed first for acne. This is the family for use for acne. Found out it's a great little secret of keeping the skin very healthy, or anti-aging, or both. So retinol A is the brand name. The generic is tretinoin or tetanoin. But you do need RX. The reason why, if it's not prescription, is cosmeceutical, like retinol, not retinoid. Very fine point, right? OL versus OIN. If it's cosmeceutical, not prescription, then it's sometimes 100 to 200 times weaker. And it's not in its active form, so retinol has to be converted into tretinoin in order for it to work. Henceforth, if it's there, it's not strong enough, and you're just paying for the brand just because they could label it that. So therefore, it should be prescription. You look at some of the high-end topical and cream, it says it has anti-aging property. It does have the compound, so they're not lying, but it's not really working. Okay, the dosing for prescription, and you can have your doctor write it. They may ask you why, because you don't have acne. The dosing is around 0.25 to 0.1% is the range that is available for prescription. You only really need that 0.05. You don't need the strongest because it can irritate. For those who have used it for acne or know someone who used acne, it can cause dryness, it can cause red and peeling. But if you use it for 4 to 8 weeks, it does get better. All that goes away, okay? So the lower the dosing, the better, less side effect, and you still get the skin health. It should apply nightly. The compound is very unstable. Even these incandescent light will deactivate it. Unless the manufacturer or your doctor tells you otherwise, don't mix it. So I mentioned about a simple regimen. This is what I use at nighttime. Not me, but what I would recommend. Actually, I do use it. So I recommend it, and you should use it. No. So just this compound by prescription at nighttime and daytime, whatever your regimen is, with SPF. That's a simple regimen. For guys who don't want a lot, moisturizer with SPF in the morning and retinoid at nighttime. So don't mix it because it can deactivate it. Like for example, Proactive, which has benzoyl peroxide in it, will deactivate the tretinoin, so it doesn't work. So don't mix it. How long should you use it? It's a slow process, so you should use it for roughly 3 months to start noticing something. But ideally, you should use it for several years and show that there's improvement. After 4 to 6 years, you can just spread it out and still get the same effect. Maybe every other day, 2 times a week, we get the same benefit as using it nightly. But sometimes that can be confusing, then just use it nightly. It's a safe drug, it's been around for decades. So at a quick glance, there's no result, right? Now let's take a closer look. You see the wrinkle up here? They're almost gone. And that's only using tretinoin after 1 year and for 5 years. And also, you see the shallowness right there? Much less so. And look at the different shallow indentation. It's smoothed out. And she said she didn't see it either. We had to bring a before and after picture. And at a quick glance, you can't tell. But look at the wrinkles on the forehead. And this is not because of the botulinum toxin injections. They've done study. If you use it every other night or once a week, initially you will not get the same results as you do nightly. Now, it might be too harsh for your skin. If as I mentioned, it's dry and all that stuff, then use it every other night or every third night until your skin have thickened and gets better, more resistance, and then you can use it nightly. And you won't even feel it. Am I doing anything to my skin? But it does. Okay, so we talked about the retinoid family, so there's a lot. I just listed a few. Actually, I was contemplating putting the whole picture of it, but there was too much. There's retinol, there's tretinoin, there's acetylcholine, adapalene, and tazartine. But just remember that retinol with the OL can be over the counter. Retinoid family can be prescription or over the counter. Tretinoin, regardless of the concentration, is prescription. These last four is prescription. I just gave some example. In 1938, the FDA, the Food and Drug Administration, gave this act, basically regulating the industry in cosmetic. Now the term cosmeceutical came about. The cosmeceutical is the difference between cosmeceutical and drug is that it has not gone through clinical trials. So therefore, but it's very subtle, it's very tricky, it's hard to say. The cosmetics, meaning the pill, the supplements, anything, it's not just cosmetic on the face, cannot legally say certain things, but they can say certain area. For example, they can't give treatment of disease, they can't say prevent the disease, they can't say change any structure or function of the body unless they go through FDA clearance and testing. But they can do a lot of stuff. For example, instead of saying lightening, which is a modification, they can say brighten your skins, which is illegal, but we don't, sometimes we forget that. Or they can say clinically proven in phase 4 trials. Anyone can go to phase 4 trial, but phase 1 through 3 is FDA regulated trials. Very subtle, right? This is my favorite on commercial. Dermatology approved or dermatologist tested recommended. Well, the term medical dermatology just is someone who does with skin. It could be a PhD. It could be anyone. So just keep that in mind. Okay, so let's talk about how do you read labels to help kind of sort some of this. Whether it's food or skin line products is listed from the most concentrated. The first one that's listed is the most in there and goes all the way down. The FDA says they don't have to list anything that's 2% or less. So there might be more stuff. So anything that's 2%, they have to list it in descending order, or so from greatest to smallest. Anything that ends in ON, O-N-E, can add some kind of smoothness. Anything that's ending in O-L is a preservative. So vitamin A, vitamin C, vitamin E are different ingredients that can go on there. Anything that's sulfate can be some kind of cleanser. O-L can also be alcohol-based as well. The labels, they have to have ingredients, the usage, warning, drug facts, directions, and inactive ingredients. Sometimes samples, they might not have it, but for the stuff that you buy, these are the stuff that they should have. So here's a couple ways to read that. So they will always have the logo, and then the next thing is how much it is. It's either in ounce or the metric, which is gram, milligram, or milliliter. And then in the back, or somewhere smaller print, are all the other stuff. And they have to list country of origin as well. So these are a couple of things that you may want to look at, just like reading food and calorie count, is the ingredients that we talked about previously. So take-home measures is prevention is key. It's very important, right? As someone mentioned, it's better to start earlier than later, but never too early. Stop smoking. No benefit. Sunscreen, sunblock regularly. Make sure you pick something that is UVA and UVB. Daily use is very important, even as early as 6 months of age, if you can. 6 months is when you can start using it safely. Moisturizer, use it regularly as well. Pick 1 or 2 of the classes that we talked about. Don't have a bunch of medley in it. Too much ingredient can actually neutralize each other out. So find something and use it that has SPF in it. You can buy it all separate. I make it simple. Moisturizer with SPF in the morning, and then a tretinoin at night. So the question is, who do you want to be? Okay, so sun damage and sunscreen and all that stuff. We want to make sure that we age gracefully. Thank you, guys.